Hi everyone, I'm Maimah Karmo and I'm your host for Breathe TV, a safe space to come to exhale and receive love, support throughout your breast cancer journey. Today I have two women with me, two women who are amazing advocates, Tameka and Lisa, both dear friends, and living through some things that we don't often want to talk about. They're both patients who are metastatic breast cancer patients, and we'll be talking about their journey, their struggles, their wins, and what they've learned throughout the journey. We'll be hearing about clinical trials and why they're so important for this community that we want to serve. I found a meditation that I wanted to share that really embodies who these women are, because they are about service. And so repeat after me. I look for ways to serve the world.
I look for ways to
serve the world.
I bring my whole heart to all that I do.
I bring my whole heart to all that I do.
I give of my time, attention, and energy.
I give of my mind, attention, and energy.
I use my gifts and talents to make the world a better place.
I use my gifts and talents to make the world a better place.
I love embodying the gift of service.
I love embodying the gift of service.
My life is a prayer.
My life is a prayer.
And so it is.
So it is. And so it is.
Thank you both for being here today. So I'll start with Lisa. I think you're fourth in your family to have had breast cancer and you're metastatic. Can you share about your journey?
So yes, I'm the fourth generation in my family to have breast cancer. But being the fourth generation, I was the first to be diagnosed de novo, even though I had been really careful and diligent with my breast health, following what was the protocols at that time. So from 35, having baseline mammograms and ultrasounds. And what I learned upon my diagnosis is that my dense breast tissue really probably required an MRI. Breast cancer is sometimes not detected because breast cancer doesn't always form in a lump. That's what we are sometimes taught to look for, and that's not always the case. So quickly, I had to figure out what I was going to do with this devastating diagnosis. When you have a diagnosis of metastatic breast cancer, it just blows your whole perception of what your life will now be. I feel very grateful that I was able to find advocacy and I was able to find mentors within the advocacy world. I'm very grateful to those mentors. And then now with the podcast that I started in July of 2020 in the beginning of the pandemic, which is all about metastatic breast cancer. And not least is Maimah. I have a lot of gratitude for you because you have been such an incredible inspiration to individuals in the breast cancer community, and you alone, I think, have started to really create these bridges amongst all members of our community. I really found that as a roadmap on how I'd like to live my life, but also live my life as an advocate.
That means a lot to me. I see you the same. We hear a lot about women overcoming breast cancer or being warriors and thrivers, but you don't hear a lot about being, metastatic. And I found that being an early stage patient, all I heard was we're going to get through this, you're going to be fine. And I just didn't know that women could die at a young age of cancer. I met a dear friend early on, and she got through her first line of treatment and she had a recurrence. And I thought she'll be fine, and she wasn't. Her name was Kristen Martinez, and there was so much I learned from her, but I didn't understand what metastatic meant. I just didn't know. I just always thought she's going to come back and be better. And then one day, one of our dear friends, Jenna, called me and said, she's not doing well, you have to come. When she passed away, my heart broke. And I thought, I'm so thankful that women who are early stage get a lot of attention to empower others to become earlier educators and be empowered. But why is she dying? Because she's metastatic and her voice is not heard enough. And then there was this gap between the meds patients and the early stagers. The women who were early stagers didn't want to hear about meds. And the women who were metastatic were like, well, they have it easier. And I'm like, well, no, we're all in this together. How do I use my service to empower people to build bridges, not to break them down? So thank you both for all you do. Tameka, can you share with the viewers your story?
I was originally diagnosed stage 2, DCIS, HER2, estrogen receptor, and progesterone receptor positive breast cancer. DCIS, which is ductal carcinoma in stew, means that my breast cancer was in the milk ducts of my breast. I was 31 when I was originally diagnosed, but what prepared me for the breast cancer journey was that when I was 13, I was diagnosed with osteosarcoma, which is cancer of the femur. So I had cancer when I was 13 years old. So I understood what the journey was going to kind of be like, but it didn't change the fear that I had because I understood what the journey was going to be like. At 31, being diagnosed with breast cancer and having a 5-year-old child, single mom, was very difficult for me. I went a few years with being in remission after I had treatment in 2013 and the cancer was removed from my breast. I decided to have a double mastectomy. I didn't have to, but that was my choice. I thought maybe that's a lesser chance that it'll come back. I will be okay. But at 36, I was diagnosed as metastatic. The cancer had traveled to my collarbone and my left lung. So that is what made me metastatic. A year prior to that, they found a nodule in my lung that my doctor had overlooked and didn't treat until a year later. So they saw it on the scan and they said it was nothing. I asked my doctor, are we concerned about this? Should I be concerned? And he said, no, everyone gets nodules all the time in their lungs, so you don't have to be worried about it. I'm not worried about it. I took his word for what it was, but it turned out to be cancer in my lung, which progressed then to my collarbone. That was a hard pill to swallow, that a whole year before they had known. They saw it on the scan and he ignored it because he felt it was nothing. When I decided to get a second opinion, my doctor's attitude towards me changed. He was like, you can get a second opinion, but the results aren't going to change. So I did. I moved to a different team, a team that was more supportive, that talked with me and not at me. It was a breath of fresh air to have a doctor who looked to not only herself for answers, but looked to multiple members of the team for answers when deciding what to do as far as treatment for me.
It hurts my heart so much. You're living in a body that there are cells that are someplace there, they're in your bloodstream, doing things that you don't know about. I want to ask you, Lisa, first, and then Tameka, how do you live with that?
It's such an important question to ask yourself. What's the lens in which you're looking at your experience in your world? And how I would answer it for myself is that there's a little bit of I don't know, and that's very unsatisfying as an answer. I'm not false positive, right? I don't have this false positivity where I walk around the world saying it's all rainbows and puppies, because it's so not. But I really do get joy, and my cup is filled when I see the beauty in the world, and I really have a practice of being grateful for what I do have. That said, I also have a lot of privileges which I recognize and know about. If I'm able to not worry about my next meal, for example, I'm not personally affected by the financial toxicity of a metastatic diagnosis, but many of our sisters and brothers, far too many in this country, have that. A smile on my face in some ways is the privilege, in a sense, because I deal with the ambiguous losses that pile up in my heart from a life that will not be as I maybe imagined it to be. A life is a challenge but that doesn't mean it's not beautiful. This is part of life. But I would say that the trauma of knowing that you're going to die no matter what from this disease, unless I get hit by a bus, that trauma, I've had some training around that for myself. That's how I'm able to have a relatively positive outlook on my life, even though it's a much shorter life than I ever expected.
You know, when I talk to people like you and Tameka, it just gives people a perspective of there's a lot to be thankful for, even in the midst of something that is terminal or trying. And so that's how I got through the pandemic, and all the losses we suffered from friends dying of COVID and cancer was just a deep practice of gratitude and meditation and learning to be present and be in the moment, because this moment's all that we have, right? Whether it's cancer or not is what we have. Tameka, what are your days like as a patient who's metastatic? Can you touch on the real deal about that?
Before I was diagnosed with metastatic breast cancer, I was a special education teacher. And I had to retire because my body could not take me being in the workforce every single day. So now my days vary with treatment. Like Lisa, I am having some struggles with the side effects of treatment. They linger a lot longer. I'm struggling with nausea. My bowels aren't moving the way that they should. And my team is trying to find the best regimen to kind of help with that. So my symptoms last at least a week after treatment. My days depend on where I am, in my treatment regimen. Some days I am tired. I cannot get out of my bed. I don't have the energy to move. And I have my daughter that I have to take to school in the morning and I have to pick up in the afternoon. My life isn't normal. There's days where I have appointments. My weeks are filled with appointments, scans, seeing my oncologist, seeing my cardiologist, seeing my orthopedic doctor for my knee because I still have to go in for that. Sometimes I have to go for physical therapy. And sometimes my pain is so bad that I'm unable to do anything around my house. It definitely varies what, my days look like, but I'm grateful to still be able to be here. I'm grateful to still be able to say that I have life. There are some days where it's hard and I'm not in the greatest mental space. And that's why I have all these positive affirmations that I look at to remind myself of where I should be mentally. I've opened myself up to more of the universe and meditation, yoga, and making sure that I'm doing self-care in order to heal myself from the inside out.
It's just so beautiful what you go through and how you choose to have a different outlook on life. And it's not easy, and every day is different. You can't plan your day sometimes. As women, we want to do it all. And you have to be able to have that grace with yourself and say, well, I can't do anything but just be today. Tameka, were you ever offered a trial right off the bat? Many Black patients are not offered or asked. What was your experience with trials?
Originally, I was not offered a trial. It was not until the first set of treatment medications stopped working that there was a trial that was available for me. And my doctors offered it to me. They told me about it. They gave me the information on it, and I decided to join the clinical trial. I was on the clinical trial for about a year and a half. It was definitely a good experience. Right now, there are no clinical trials that are available to me, but they have been looking for other clinical trials for me. So that is a good part of what my team has been able to offer. So I've been lucky in that aspect.
So many people, especially people of color, have been through so many things with trials that are just horrendously inhuman. And there's a lot of mistrust in trials. You were not offered a trial, but you ended up getting into one, and you're still here, which is great, right? So it worked in some way. What would you tell somebody who's afraid of a trial or, thinking about what's happened in the past, because they're not aware of all the safety around trials now and the regulations around it? And can you share for those who are maybe afraid of a trial or not trusting what the benefits are to especially Black women?
The benefits are that they are learning more about us as Black women, how the medications affect us in our bodies and what they can do to help us even further. So I think that, yes, it's a scary thing to join a clinical trial, but there's so many benefits of helping others. So I think that if we continue to ask the questions about clinical trials, look for them, I think that it's just advocating for yourself and wanting to help others in addition to helping yourself by joining the clinical trials.
And that could change the outcome for Black women everywhere because, our goal is ultimately to make breast cancer not a terminal one when you're metastatic. So that's our end goal. Lisa, what is your experience about clinical trials? And what are you dealing with right now in terms of trials?
I'm really excited that we're talking about clinical trials because with no clinical trials on the horizon, all of a sudden was potentially eligible for 2. I always say it's like you got to stay on the lily pad long enough so you can jump to the next lily pad. Sometimes you have to just kind of hold the course. I've been on 3 clinical trials now. When I was first diagnosed, I went on standard of care, which was, an oral therapy, and for me, easy to tolerate. When I progressed on that, which was, obviously my first progression, and it was really disappointing, I then was able to look around with my oncologist because I'm in an NCI. At my institution, there's a lot of opportunity for clinical trials. That's why I chose that institution to be treated. And I encourage anyone that I meet who's newly diagnosed, if they're not at an NCI designated facility or institution hospital, that they should get a second opinion. Even if things are going great with your oncologist at that moment, that's what I always encourage people to do because you have more access. They have more clinical trials on site at the hospital where you're being treated. And that's a really important thing to keep in mind. So quickly we get to a point where there are no other FDA approved drugs for us. And if they're no longer working for us, then it's chemo or a clinical trial. So in my own experience, I have done an immunotherapy trial, which was designed in a really interesting way that you would be randomized into 4 arms. If you progressed on one of those arms, then you were given a different drug. Like you weren't kicked out of the trial right away. You were given a different drug to see if there was a difference in your response. So that was a more, creative clinical trial design. And then I've been on more standard ones where if you progress on that particular trial drug, then you are then bounced out of the trial, but your data is helpful to others and to the investigators of that trial drug. And it was shocking to all the people I talked to that in January of 2021, I was eligible for maybe 1 trial, but pretty much no real interesting trials anywhere in the United States. And that's because I had progressed, but also more importantly, I had no actionable mutations. So trials often allow you to have access to a trial if you have a mutation that they're targeting, and that makes sense. But they also don't like to have treatment mature patients on a trial. And so they usually limit how many treatments you've had to 3 or maybe 4. And I blew through 3 and 4 treatments, in year 2 of my diagnosis. And now I'm at almost year 5. And so I'm already at 7th line of treatment. And that means I'm like so treatment mature that most trials and trial designers wouldn't want me on the trial according to them because they don't know what's working in my body, keeping the cancer at bay, or what's not working. Is it all those previous drugs that I've taken and trials that I've been on, or is it this new drug? So I understand why treatment mature individuals like myself are not attractive to a clinical trial designer or a principal investigator. But it's not good for people like us who are living with metastatic disease who have no other choices. There are options for metastatic patients to advocate and agitate and apply for the right to take a drug. And further to that, I think we should change or try to get a change in clinical trial design so that if you go on a clinical trial, if you are metastatic, if you progress on the non-trial drug, and it's usually a chemo that they give you as an alternative to the trial drug, then you should be given access to the trial drug. And far too many designs do not allow the patient, the terminal stage 4 patient who's been randomized to standard of care chemo, which is all that most of us have left to use. And then once we progress on that, because you ultimately always progress, then why wouldn't you want to let that terminal stage 4 patient to have access to the trial drug that could have really helped them?
That's why it's important to have patients involved in creating the trial design, like being involved at that time. Here's a trial drug you're on right now, and then once that stops working, the next little lily pad's right there. You jump on that pad, and then you stay there for a while, and then the next one. The urgency is that if you don't have that next trial to be on, that could be end of life, and that's not acceptable for us, for you, for any of us. Tameka and Lisa, you're both very busy advocating. You're mothers, you're looking for trials, you're dealing with side effects. You have like 2 different jobs. You have one job is your home life, one job is your job life, the other job is your health care, and then your other job, which could be a full-time other job, so you have like 6 jobs, is advocacy, because you're both very involved in sharing your perspectives. How do you balance the very real needs you have as a patient who's metastatic with advocating? Tameka?
For me, it's a daily thing. If I'm not advocating for myself, I'm advocating for others with my post or on social media, or just me talking to my team about if there's a new clinical trial that I can join, or what the next steps are for my treatment plan. So it's a daily thing, just advocating for myself or others. That's my goal and my purpose at the end of the day on this journey.
Yeah, thank you so much for your service. Lisa, talk about why you began the podcast, why it's so important to you. And for those who have never heard her podcast, it's called Our MBC Life. You have to tune in. It's awesome.
Yeah, thank you so much, Maimah. I had a wonderful team of people that started it with me. Victoria Goldberg is still part of the senior team. We are a podcast that is written, hosted, produced, sound engineered. All of that had been done initially all by people living with metastatic breast cancer. We started it because we wanted to have our voice to be amplified, and I felt like there is so much great information that's done in webinars and even Facebook Live and YouTube, and there's so much out there. And I felt like I was such a lover of podcasts that I listen to podcasts all the time, and when I'm in the car, when I'm doing laundry or whatever, and I thought fellow individuals living with MBC may have the same feeling that, wow, I wish I could get that great information about that new treatment or that new research that oncologist in St. Louis is doing, or what is palliative care, or what is hospice actually, and why does it sound so scary, and why I shouldn't be scared. What's brain metastases? That sounds terrifying. Maybe I can find out more. All of that in a podcast wherever you're going, and you're going on a walk. And I just felt like it was a medium that we could really explore. I didn't see anything like this out there, and I felt it's something we needed as a community. And so it is with so much joy that I get to work and play with the most talented, inspiring advocates who are part of our podcast team. And we have a very diverse team of people who have voices that are different than mine, and that's what's important, because it's a podcast for us and by us. And so thank you so much, Maimah, for letting me talk about it, because it's also my joy.
Lisa, how can our viewers find our MBC Life podcast?
Sure, thank you. Anywhere you get your podcasts. We are on Spotify and Apple and Google and all that stuff. You can get it anywhere. And we also can be found on our website, and you can download episodes and listen to them there, which might be easier for some people. And that's ourmbclife.org.
So Lisa, you have another project called the Central Park Tree, MBC Tree for Everyone. Can you share more about that?
Sure. So I've been really fortunate and blessed, actually, to be part of a support group very soon after I was diagnosed, out of the place where I'm treated at Memorial Sloan Kettering in New York City. And we experienced many, many losses of dear, dear friends in our support group. And we tried to do memorials for our friends, because it's part of this difficult grief where you're very, very close to people who are living with the same disease as yourself, but you may not know their families or their friends in their other life, right? Sometimes there's a real demarcation between your life before cancer and then your cancer life. So what we were finding was a difficulty in having the ability to honor our friends in a way that honored our experience with them, our relationship with them. And so we started doing these online memorials. We did some memorials in person. And then the pandemic hit, and all during this time, one of our friends, she's now died of metastatic breast cancer, she was thinking of different ways to have memorials for people living with metastatic breast cancer. And with her inspiration, we applied and went to Central Park Conservancy, and we raised the funds, and we designated a tree in Central Park just over the Gapstow Bridge near 60th and 5th. And it's the most beautiful, peaceful spot, a place where you can picnic, where you can remember the people that you've lost to metastatic breast cancer. I know some ashes have been scattered there. I know we have rocks that we put there for our ceremonies. It's a very special place.
It's so amazing that you do that. You guys turn the beauty and the ashes into something that can grow and live forever. Tameka, are there any special projects you're working on right now that you want to share with our viewers?
I actually blog. My blog is called Evolving Soul. So I just share my journey there, my feelings. I am also working on a book. I'm in the editing phase of my book that's called Evolving Soul. I'm super excited about that. I'm hoping to have it released for Mother's Day. That's my very special project that is dedicated to my daughter, London. Moving forward, I'm trying to get more into advocacy and fighting for our MBC patients, such as myself.
And that's a lot of freaking work. That's a lot of work. It's a lot of work. Before we sign off, what is one word that you want to leave the viewers with as it pertains to MBC and or clinical trials for your community? We'll start with Tameka.
Inspire.
Inspire. I love that. Lisa?
I'm landing on innovate, but then I was going to say the word persist.
I'm thinking that the words I would use are dream and disrupt. Talking about dreaming and disrupting, I want to honor our special friend Tori Guy. Tori was an amazing human being. I met Tori when I went to a patient advocacy initiative, and she came in walking in with a Tigerlily Hope bag. And she said she wanted to meet me. She said that she got in the bag when she was first diagnosed, and she wore it all the time. And she said she was metastatic. And she was so positive and so full of life and so staunch in her faith and in community and working to end disparities and barriers. Up until she died, she was advocating and preparing others to take over her work, when she was not here. Tori was one of also our first Breathe TV episodes. At the time, she was going through a lot as well, but she still showed up for those who need to hear her voice.
I just hit my 5th Christmas with metastatic breast cancer. But when you look at the odds and the fact that less than 25% of the people that I was diagnosed with that had metastatic breast cancer are still alive today, and that number is only going down. We really need more. We need more research. We need more resources. We need more medications. And all around, we need public policy that supports these things to make sure that we can have access to care. And I had no idea that metastatic breast cancer was a terminal diagnosis. We want to treat it like a chronic diagnosis as much as possible. But the fact that almost 75% of the people who are diagnosed with metastatic breast cancer aren't alive in 5 years means we can't call it chronic yet. It's a terminal diagnosis. And the way that we treat it is we're on a treatment as long as it's working on the cancer. However, when you get to a point where you progress enough, you have to switch treatments. And you pray to God that there's something that's going to be there when that happens. But eventually I'm going to run out of treatments. And that's the sad reality of this disease, is science is not keeping up with the cancer. It's not patients who fail, it's science that failed us, and science that didn't keep up with our disease.
That was Tori, always working, always inspiring, always dreaming, always doing, always innovating, always fearless. And I do miss her dearly, so much. But what I've learned throughout this work is that when you lose someone, you grieve, but then you plant a tree. You plant a tree, a physical tree, or plant a tree in your soul that the person becomes part of you. So I want to honor Tori with this episode. It's going to be in honor of her life, her legacy, and we'll see you soon, my friend. Much love. Thanks for watching, everyone. This is Maimah Karmo, and you're watching Breathe TV. Bye for now.
The problem is that when you're living with metastatic disease, you have to be in treatment to survive. I'm now failing this current clinical trial that I'm on, so I'm running out of choices in terms of my treatment. From an early age, I've had this notion that death can be better. Our society stigmatizes death. No one wants to talk about it. Everyone's trying to extend their life, and I understand that. I take really toxic drugs to try to extend my life, but society can be more open to the beauty in a life well lived. As much as we prepare for the birth of a child, we should also think about and be prepared for our own deaths, and that can be really a beautiful thing in the end.